Good day, I am Katherine Majaba, a nursing student from Marinduque State College. This day I'm going to perform medical hand washing with a WHO 1, 2, 3, 4, 5 procedure. For the preparation, first is gather all the equipment needed to save time and effort. Next is assess your hands. Nails should be kept short. Short nails are less to harbor microorganisms. Next is check your hands for the breaks in the skin. The one who has open sores may require work assignment with a decreased risk of transfer of microorganisms. Next is remove all the jewelries. Microorganisms may lodge on the setting of the jewelries. And for the procedure, if you're going to wash your hands where the clients can observe you, explain what you're going to do and why it is necessary. Next is turn on the faucet using a paper towel and adjust the flow so that the water is warm. Handle of the faucet is covered with microorganisms, and warm water are less to remove of the protective oils. And wet your hands thoroughly under the running water and hold them under the running water lower than the elbow so that the water will flow from your arms to the fingertips. If you're going to use a liquid soap, apply 2 to 4 ml or 1 teaspoon. And if it is a soap, and firmly rub it against your hands. And thoroughly wash your hands. Thoroughly wash your hands using a rub, firm, and a circular motion starting from the palm. Next is finger interlace, back of the hand, fingers, thumb, and lastly the wrist. And then rinse your hands. Dry your hands using a paper towel. And dispose the towel on an appropriate container. And next is turn on the faucet. And that's the medical hand washing with a WHO 1, 2, 3, 4, 5 procedure. Hi ma'am, good morning. I'm Katherine Mahaba and I'm your student nurse for today. So what I'm going to do is I'm going to assess your vital signs, which includes the temperature, your pulse, your respiration, and your blood pressure. So at first I'm going to assess you first your temperature. So I'm assessing temperature. First I'm going to check the physician's order or the nursing care plan for frequency and route. So after checking, I'm going to identify my patient. So ma'am, may I ask for your name?
I am Joy and Mahaba.
Okay, so thank you. After identifying my patient, I'm going to gather all my equipment needed, which includes the digital thermometer, a wet and dry cotton balls. So next is I'm going to make sure that my digital thermometer is working. After that is I'm going to perform hand hygiene. After performing hand hygiene, I'm going to select an appropriate site for getting her temperature. So ma'am, do you have any preference on getting your temperature?
Here.
Okay, so thank you. After selecting the appropriate site, I'm going to follow all the steps for the appropriate type of thermometer. After that, I'm going to ensure my client's privacy by drawing the curtain or by closing the door. So assuming that I already closed the door and draw the curtain, I'm going to place my patient on a comfortable position. So ma'am, are you comfortable in your position right now?
Yes.
Okay, so thank you. I'm now after placing my patient on a comfortable position, I'm going to I'm going to move up her sleeve to expose the axilla. So ma'am, I'm just going to move up your sleeve to expose your axilla. Thank you. So now I'm going to clean my digital thermometer using a wet cotton balls and dry it using a dry cotton ball. Starting from the ball to stem. And put it at the appropriate receptacle. Now I'm going to place the probe at the center of the axilla of the patient. So ma'am, was it in the center?
Yes.
So thank you. So now ma'am, you're going to hold it at its place until it beeps, and with your arms down, or your hands down and close to the body. So we're just going to her wait the reading of the temperature and note the reading. So I'm going to get it. So ma'am, your temperature is 36.8, which is in the range of normal. So now I'm going to clean the thermometer using a wet cotton ball starting from the stem to ball. And I'm going to note the reading of my patient. And next ma'am, I'm going to assess your pulse. I'm going to assess your pulse, which I'm going to assess your pulse using my second hand of my watch, and I'm going to assess it on 1 full minute. So I'm going to now I'm going to gather all my equipment needed, which includes my wrist or my watch with a second hand, and with a second hand. And next is I'm going to perform hand hygiene. So after performing hand hygiene, I'm going to select an appropriate site where I'm going to take her pulse. So ma'am, do you have any preference in getting your pulse? Oh, okay, thank you. So I'm going to I'm going to follow all the steps for an appropriate type or appropriate pulse assessment. So next is I'm going to place my patient in a comfortable position with her arm 90-degree angle, and with his wrist extended and her palm downward or face laterally. So I'm going now to place my first, second, and third fingers on the radius and my thumb at the back of her wrist. And I'm going to apply only enough pressure to fill the artery, and using my watch with the second hand, count the pulsation I'm going to count the pulsation in 1 full minute. So now, while my fingers are still in place, I'm going to assess my patient's respiration and note the rise and fall of the chest. And using a using a watch with the second hand, I'm going to count the respiration of my patient in 1 full minute. So now the respiration and the pulse of my patient is 65 and the respiration is 18. So now I'm going to take my patient's blood pressure. So ma'am, now I'm after assessing your pulse, your temperature, your pulse, and respiration. Now I'm going to take her blood pressure. So after explaining what I'm going to do is I'm going to gather all my equipment needed, which includes the BP apparatus, a stethoscope, and a stethoscope. So next is I'm going to perform hand hygiene. After performing hand hygiene, uh, there could be a delay on obtaining blood pressure if the patient is emotionally upset, in pain, or or just exercise. Or just exercise unless there is an unless it is urgent on obtaining the blood pressure. Next is I'm going to select an appropriate site for taking her blood pressure. Do you have any preference on getting your blood pressure? Okay. So I'm going to take her blood pressure on her left arm. So after that is I'm going to have my patient on a supine or sitting position, which she can be comfortably, which is she is comfortable. So next is I'm going to I'm going to I'm going to center the cuff. Right. What I mean is I'm going before centering the cuff. Right. I'm going to expose my patient's arm by moving her sleeves up with her forearm at a 90-degree angle at the level of the heart with her wrist extended in her palm upward. So now I'm going to center the cuff above the brachial artery and the end of the cuff 2.5 to 5 centimeter or 1 to 2 inches above the inner aspect of the elbow. So next is I'm going to wrap the cuff firmly and snugly around the arm, firm and secure it. After wrapping is I'm going to check the needle of the gauge if it is within 0. Okay, so after that is I'm going to palpate the brachial artery using my fingers and using only an enough pressure. Make sure and next is I'm going to tighten up the screw bulb. After tightening is I'm going to place the stethoscope earpiece and I before placing the stethoscope and the stethoscope earpiece, I'm going to assume a position not more than 3 meters away from the gauge. Next is I'm going to place the stethoscope earpiece in the ear with the earpiece forward into the canal. So next is I'm going to place the bell or the diaphragm across firm with using only enough pressure onto the brachial artery. And I'm going to pump the pressure 30 millimeter per mercury above the palpated and estimated systolic pressure, and allowing the gauge to drop 2 to 3 millimeter mercury per beat per second or per heartbeat. And I'm going to note the first pain, which is the systolic pressure, and read the pressure read the pressure near the even number, and I'm going to note where the sound muffled, and also where the sound disappeared. And I'm going to allow the air to be released. So mom, your BP is 110 over 90. So next after that is I'm going to first is I'm going to perform hand hygiene after. So what I'm going to do is I'm going to record all the assessment, which is includes the temperature, the pulse, the respiration, and the blood pressure on a paper flow sheet, or on the computer record, and put if there are any abnormal findings. And that's